Before the surgery, I have severe pain in my lower back and in my arm, complete numbness. For the last year, I could not walk properly. I could not stand properly. I decided to look overseas to decide who's the best doctor for me, and I decided to come here.
Well, Mr. Saeed really had two problems. He had a problem with his neck and one with his lower back. So the more urgent of the two was actually in his neck, where he had 3 herniated discs and he had some pressure on his spinal cord. In his lumbar spine, he had just chronic back pain of several years, and they did not responded to physical therapy, injections, and other non-operative treatment options, and he elected to have treatment for that at this time as well. In the case of his cervical spine or his neck, we did a surgery from the front with a transverse incision. We were able to fuse 3 levels, and we then proceeded to do a minimally invasive L4-5 lumbar fusion to treat his back pain.
I feel like excellent right now. I feel I can walk properly, I can stand up properly. That's something that really makes me feel good. I look at myself in the mirror, I'm standing up. That bending, that's something I didn't feel for the last 2 years maybe.
Fortunately, we do have a partnership with Harris County EMS, who have access to global transportation. They bring along to the table being able to get us those patients, no matter how critically ill, elderly, or how sickly they may be, or even if they are in such pain that they need intravenous Demerol or morphine to get them through that trip. We do have that delivery mechanism, and we're very fortunate to have that partnership.
Dr. Siddiqui and our company have a long history of transporting his patients from where they need to go anywhere in the world. We have flight teams, we have ground teams, flight nurses, flight paramedics. We can pick them up in a concierge service from a limo to an ambulance. They can fly in to see Dr. Siddiqui. So Dr. Siddiqui will then evaluate them, treat him, have the surgery, whatever the patient needs, and then we escort the patient back to where they need to go.
Since the surgery until now, I've been looked after, pampered, as you say, really from the office for everything I need. I just need a phone call and the clinic took care of everything. They gave me the physical therapy in-house, and really it's excellent physical therapist. He's a motivator. He knows how to make you work. I can walk almost properly. I don't feel pain at all. I feel excellent. And I feel now with gonna take it slowly for a while to recover, but I feel like I can get this life back, really. I can go and to my boat and go to my jet skis as I used to do before, camping, and enjoy life.
In this day and age, we have the technology to be able to reach all patients no matter where in the world they may be, and that the patient transportation methodology is available for them to get to us. And we have the diagnostics and the facilities available to deliver the care in a minimally invasive technique, be able to recover them, do the physical therapy right here, and they're able to get back to their hometown within a 2 to 3 week time frame total. We are set up to take people from overseas. If you're not from Houston, Texas, that should not be a reason to not get this type of spinal care, no matter where in the world you are.